celebrate us. This year theme is occupational therapy for all, and I believe either now or later, we all, whether we like it or not, we are all going to benefit from occupational therapy. So on this note, I want to welcome everyone to this great day, which is Occupational Day for 2024. Please let us enjoy ourselves and listen to our guest lecturer as we move on. Thank you so much.
A round of applause for the Vice Chancellor, who is represented by the Dean, Faculty of Medical Rehabilitation. We'll move straight to the welcome address by the Program Director, no other person but Mr. Ayeni. A round of applause for Mr. Ayeni.
Vice Chancellor, ably represented by the Dean of the Faculty, Professor E.C. Onikude, the Librarian of the University, other invited guests, Deans of Faculty, Directors of Centers, Professors, Heads of Departments and Units, invited guests and speakers, distinguished colleagues and friends, staff and students of the department, ladies and gentlemen. It is with great joy and enthusiasm to join other professional colleagues to celebrate annual World Occupational Therapy Day in our university, which marked the second of such events here in our university. The day set aside to appreciate occupational therapists for their tremendous efforts in restoring functionality and independent living among their clients and patients. But here in UNIMED, the celebration goes beyond that. Rather, it is an avenue to create awareness and sensitization on the meaning of occupational therapy within the university and the hospital community. The two-day event that started yesterday with a seminar presentation at the hospital to discuss the role and relevance of occupational therapy to healthcare practice, and today we are here to discuss this theme for this year, occupational therapy for all. Also, World OT Day in our university is another opportunity to educate and convince fresh students who heard about OT for the first time when they checked their admission status. Last year, we had over 80 students who were given occupational therapy and were divided on what is and what is not. But shortly after this event last year, they found a career path. This we have made a tradition to follow in the years to come, to preach the gospel of occupational therapy for all and to all. May I remind us that the Department of Occupational Therapy of this university is the first full-fledged Department of Occupational Therapy in Nigeria, and being the first, we are committed to nothing but the best in training, research, and clinical skills. This vision, the management has set in motion through the purchase and supply of our multi-million equipment for the department. I can only say that no OT facility in Nigeria can boast of what we have here in UNIMED. And the ongoing building project that we house department alongside other programs within the Faculty of Medical Rehab is another visible evidence to the commitment of this management. Furthermore, the management through the Vice Chancellor, Professor Adesheku, is intentional in building the best department, not just verbally, but in hiring the best brain occupational therapists within and outside Nigeria. As a department, we are not committed to only admitting and graduating fresh students, but we are committed to serve as a bridge in the training of occupational therapists in Nigeria through the provision of transitional pathway for diploma holders in occupational therapy. For we know that we are blessed and surrounded by a high number of diploma holders that need to transit from diploma certificate into any degree program to ensure the growth of this profession. This we have attained success in doing, and in the coming months, several programs are available to be rolled out on how to assist diploma holders in transiting to degree holders. Not only that, as a department, we are equally extending hours of partnership and support to all diplomas that are ready and willing for the training of occupational therapists in Nigeria. Talking about the board, note that the Faculty of Medical Rehab here in UNIMED is one-stop shop for all medical rehabilitation professions, and occupational therapy is one of such programs. We sure can boast of the best department of OT in Nigeria. Even the Medical Rehabilitation Therapist Board is proud of what we have here in UNIMED. Outside Nigeria, our department has commenced the process and now on the last phase to be the first full accredited OT training institution in Nigeria. The process, which will be completed in the early part of next year. However, we cannot celebrate World Old Day without mentioning a few of our challenges, which has to do with the issue of manpower. Over time, our department holds the title of one-man department in the faculty, if not the entire university. But the story has recently changed. We do believe and hope that the nomenclature will change again from the current title by having more hands to build our Macedonia. I cannot but mention the tremendous effort of all our adjunct lecturers who have played their parts in seeing to the growth of this profession, especially this department. Dr. Oye Olawe is a great leader and elder statesman of the profession. Mr. Laje has been a good staff to reference as well. The Occupational University OT family has been wonderful, though 90% of them are outside Nigeria, but they are always ready to assist us when the need arises. I can't but appreciate the likes of Dr. Joshua Ige, Mrs. Cheyi Ojurogbe, Mr. Tosin Ajakaye, Mr. and Mrs. Olatoye, Mr. Victor Ogundele, Ms. Tobi Ogundele, and many others who have been consistent in sending their good video for World OT Day and are ready to serve as volunteers in take courses peculiar to their area of practice when the time arises. As I begin to conclude this address, I would like to especially appreciate the honorable members of the Faculty of Medical Rehabilitation, most especially the Dean of the Faculty, Professor TETFUND, for being a leader, father, and mentor. Thank you for serving the dual role of the Dean and HOD for the department. All our fathers and mothers in the faculty have been wonderful. Professor W. Olawe, Baba S. Opatade, Mrs. Grace Ademola Shukoya, and Mrs. Grace Oduniyi, who was present with us at the seminar presentation yesterday. Our senior colleagues in the faculty, Dr. and Dr. Mrs. Amolabi, Mr. Awotipe, the Board of Deans, Mrs. Anya Susan, and my faculty twin sister, Ms. Tosin Tekele, thank you for supporting our programs and activities. I equally appreciate all the non-teaching staff of the faculty and department for your great work of sending, tracing, and updating memory. Finally, I must appreciate my friend and colleague, Mr. Apa Ifeanyi, who joined us last month and has ensured the success of this program. He is the chairman planning committee of this event. Thank you for your support and interest. The theme for this year's event, Occupational Therapy for All, is timely and needed at this time of our DAPA syndrome in Nigeria, where we have more than 80% of OTs practicing on the other side of the sea. These are the most positive facilities within the country to be without personnel. It is quite easy to list and name OTs practicing in Nigeria in all the hospitals that we have within a minute. But this will be for a short time, as we are set to make a difference in churning out the finest occupational therapies that Nigeria have ever seen, the Unimed OT. Then we tell the whole world that occupational therapy is for all. I appreciate our guest speakers today, Mrs. Kevin Peters, the CEO and founder of Enablability Occupational Therapy Clinic, the first and still the best private occupational therapy clinic in Nigeria. Mr. Ogundele Victor is a good friend and colleague, and a friend of our program since day one. Thank you for accepting this invitation despite your tight schedule, SARS and MA. Dear students, you have been privileged to be in a promising profession, no doubt, and studying occupational therapy will be one of the best choice that you will make in life. In the years to come, you will look back and shout, Eureka, I found it. You have found purpose, relevance, and lasting impact. So I encourage you to put in your very best in the program to achieve the best. The 5 years in this program will not be easy, but sure it is surmountable and it is achievable. Tell yourself, I can do it. In the next 3 years, if you do not give up, we'll be adding your name to the registrant list of the board. Until then, keep reading, keep smashing the grades. You are hard on the right path. Thank you all for coming. Happy birthday.
A round of applause for the HOD Occupational Therapy. So we move straight to the first lecture by Mrs. Kemi Peters. And before then, a citation will be read by Sharon Baba. A round of applause for Ms. Sharon Baba. She steps forward. Let's keep clapping.
Good day, everyone. Sharon Baba, a 200-level student in the Department of Occupational Therapy, and this is a brief but no doubt interesting professional biography of an outstanding woman called Kemi Peters. Kemi Peters is a qualified and licensed occupational therapist at Ability Occupational Therapy Limited and Ability OT, where she treats children, young people, and adults who have physical or learning disabilities and ailments, such as acquired brain injury, orthopedic conditions, stroke, long-term neurological conditions, mental health disorders, and ASD. Her specialized care experience cuts through pediatrics in the treating of premature infants, babies and toddlers in early interventions, and children in public and private schools, forensic mental health, acute surgery, or medical and elderly rehabilitation. With these experiences, she has been afforded opportunities to work with the National Health Service, also known as NHS, private and charitable sectors across 3 continents. Kemi Peters has achieved numerous feats and remains unstoppable as she is committed to being the hand of hope and healing to those that can benefit. Currently, she works at Ability OT, the first registered and accredited private occupational therapy clinic in Lagos, Nigeria. Aside this, she sits on the board of ABA Maternal and Child Health International Foundation, AMCH, which is a non-profit, non-governmental organization with the aim of providing up-to-date evidence-based life-saving knowledge and skill to frontline health workers in communities across Nigeria. Kemi and her husband are supporters of Right to Life of Michigan, and she is also on the board of other organizations such as Haven of Hope Ministries, Impact Pregnancy Resource Centers, and the House of Esther, all in the United States of America. She also volunteers at few orphanages in Lagos, Nigeria, to provide care to children at risk. She works with a team of healthcare professionals like pediatricians, opticians, dentists, general physicians, nurses, and pharmacists to provide free health care to residencies of Makoko, Maroko, and Okota. Please let us give a hearty round of applause for a remarkable, exceptional, absolutely extraordinary woman.
Hello, good morning. Can you hear me?
We can hear you. We can hear you.
Thank you very much. And thank you. To stay on to take questions and answers. I will talk to those that are able to make it happen. We can schedule another day where we can take questions and answers. I will be more than happy to do that if I'm not able to do that today. So basically we're talking about AT, and it is definitely an honor. It is a privilege for those of you that are currently occupational therapists that are practicing, and for those that are aspiring to be an occupational therapist to practice.
Recording in progress.
You definitely are in the right profession at the right time based on what is going on around the world. And this occupation would always be on demand until eternity. Studying occupational therapy, and as well as for those that are practicing to be practicing as an occupational therapist. So we're going to be talking about the words of occupational therapy. We're going to be talking about the prospects, of occupational therapy, and we're going to be talking about in the area of the prospect. We're going to look at some of the things that are lined out for future and the future of occupational therapy, as well as why we need to jump in the boat now and do what we need to do and be the best that we can be in our profession. Yeah. So I believe that a lot of you that are studying occupational therapy, you already have an idea about the history of occupational therapy and what occupational therapy is. So I wouldn't want to waste too much time to talk about what occupational therapy is correctly, because I like to be interactive. I'm so sorry I couldn't be there today because I have a lot of responsibilities that I need to attend to that were pending before today. So I like to be interactive. I know I'm presenting via online. If it's possible, I would like 1 or 2 mics to be in the audience as well, and love people to talk back to me when I talk and when I ask questions. So please make that available. Yeah, so make that available. So if I can hear 1 or 2, what is occupational therapy to you? What is occupational therapy to you? For some of us that are there, what is occupational therapy? Yeah, can I get responses? Yes, no? Can you still hear me? Can you hear me? Okay, thank you. Okay, I need feedback so I know that you guys are hearing me. So I said, what is occupational therapy? Well, in a nutshell, we can say occupational therapy is an aspect of healthcare that deals with health and social care. Yeah, and we help people to be able to live their life independently, irrespective of limitations or deformity. That's the simplest way I'm going to put it this morning. And from that also we have the American Association of Occupational Therapy. I believe that you all can follow the slide as well. And then it talks about occupational therapy practice addressing the physical, the cognitive, the social, the psychosocial, the sensory perceptual, as well as other aspects of the clients, performing a variety of contexts to support their engagement, occupations, and the things that affect their physical, mental, and their well-being in general. Yeah? So, occupational therapy is a healthcare profession that helps individuals develop, recover, or maintain daily living and work skills. Okay. So, I'm going to jump, like I said, you all are already in that field, you already know what you're studying, so I don't need to kind of go over this again. Yeah, so occupational therapy aims to develop and improve the skills that is needed to live an independent, productive life. Independent, productive life, irrespective of the limitations or deformities or the challenges the individual might be going through. And these are exhibited, or these can be done in the areas of self-care, productivity, that is your work, your job, in mobility as well, in what we do. We're driving, we're walking, we're cycling, all aspects of mobility. Yeah, and occupational therapy can help us to cope with new demands that depend on our physical ability as well as our mental, psychological ability. Yes? So we can see that what we're doing actually addresses the whole individual, the whole person. So we are in a profession that is holistic, and I dare to say that occupational therapy is the only profession that looks at, treats, interacts with an individual in a holistic way. No other profession would do that, would do what we do. We look at the individual as a whole in a holistic way. Yeah. So what are some core principles of occupational therapy? Some of them are, we are client-centered. We focus on our clients, we focus on their needs, we focus on their aspiration, as well as when we interact with our clients, we put into consideration their autonomy. We don't make decisions for them, we help them, we guide them to the right decisions that will help them to lead a full, independent life. What does it mean by occupational center? We look at every activities that individuals engage in, and we look at how we can make it happen for them. We can approach it from that aspect of their occupation, and it's possible for them to live a fulfilled life, to have a meaningful life in their role, in their occupation, and in what they engage in on a daily basis. And guess what? Occupational therapy is evidence-based. It is totally evidence-based, because in everything we're doing, you will see the evidence in the progress, in the disability coming and ability for the individual now. Yeah, I'm kind of just summarizing and I'm not going through line by line. Yeah, so in everything we do, it's evidence-based, and research continues to improve in a lot of ways. And guess what? We're going to get to the aspect of where the things that we do, a lot of researchers are also coming to terms to see it and to see how it helps us. And it helps the individuals, it helps the community, it helps the society at large. Yeah. So, core values of occupational therapy. What are the core values of occupational therapy? These are part of the core values of occupational therapy. We respect our clients or our patients. We have compassion for them. We do not sympathize with them, we empathize with them. We do not pity them. We have compassion and we have empathy for them. We see everyone that everyone has something to put in. Everyone has something they can also input and include in what they are doing or what we're doing in the society. We empower them. We empower them. Let them know that, hey, whatever you're going through right now, guess what? There is a way out, and there is even a better way to do it. Yeah, and guess what? When it comes to equality, we do not discriminate between anybody, male, female, adults, children, able or physically challenged. We do not discriminate. We give equal opportunity to everybody to thrive, to live independently in any environment that they may find themselves, and to be able to optimize their maximum potential irrespective of the limitation or disability. Take note of some of those keywords. That is part of what we are about as occupational therapists. And guess what? Occupational therapists are innovative. We think out of the box. We are very, very creative. I dare to say we are super creative. There are lots of gadgets that we use in the medical arena today that the inception and the conceptions were through occupational therapists. Yeah? So those are one of the things that we do at home. Yeah, so we're going to go to the next slide. And what do we believe? What do we believe? What do we believe? We'll get to it. And also a brief history of occupational therapy you all may have heard about it before, but a part of how occupational therapy came into being was during the World War, when we had a lot of summarizing. Sorry, my slide is going back. Let's just go back. So I'm summarizing. During the World War, we had a lot of people that were into the world. We had a lot of people that big state heavily had a lot of people that had post-traumatic due to everything. Smoking, food, a lot of like some kind of mothers of occupational therapy, come out to be able to help the crafts and activities. And moving from there, they also help them in the area of the mental health, those that were going through some psychiatric challenges, those that had orthopedic issues. We made it possible for them to be able to go back into the community, to live a functional, independent life, as well as to contribute to the society. So that is what I'm going to say about this slide in a nutshell. Yeah, and we move to the next one. OT education. You're privileged to be in an institution where they are providing occupational therapy. Because I remember when I returned back to Nigeria, the only institutions that were functioning then were FSOT in Lagos and Obafemi Awolowo University in Ilefe. And thank God that there is something now other than those other institutions, and I hope that we are going to have more. And I believe that I was informed that there is one in Kano or in Kaduna. I'm not 100% sure what is on my slide, because I did ask somebody to research for me. So we're privileged to be part of those that are in UNIMED, and please take note of what is happening in your institution and be among those that will be the trailblazers in that institution. Be the best that you can be and come out into the arena of where we are practicing and make a cure.
Recording in progress. Recording in progress.
Okay, I was informed that there was a network issue, so I asked if I should pause. So I'm pausing. Should I continue? Thank you very much. So like I was talking about the structure and the course structure and curriculum, and I'm sure your university would already give you information, and those that are prospective students that are going into the study of occupational therapy. So I stopped at the introduction to occupational therapy. History, principles, and practice of OT are part of the things that we learn during our study to be an occupational therapist. You know, the human development, which would include the study of developmental stages across the lifespan, from neonatal to the older people. Then we have in mental health the approaches for addressing emotional and psychological well-being. Yeah. Then we also talk about the assistive technology and environmental modification, use of adaptation devices, use of daily aids, walking aids, and a lot of other things. Then also we look at the leadership and administrative aspect in OT, and not just in occupational therapy, in healthcare as a whole, because we are a part of a multidisciplinary team that makes it possible for somebody to go back to their lifestyle, irrespective of what may have happened. And we are a crucial aspect of that multidisciplinary team. So these are few things that we learn, you know, in OT, and also like one of the core things that we learned also when I was in school over 20 years ago was that we learned about health, people, and society, and also the future of healthcare and what is happening. Actually, kind of what is happening right now, you know, I learned about it, and part of what is happening to OT, I learned about it in school many years ago, and I see them moving out right now. So that is part of the structure and the things we learn when we go into this course of occupational therapy, and then we do the PhD as we will and as we wish to do so. And the other crucial aspect of it is highly important for all occupational therapists to be licensed. Because why? Occupational therapy is a protected profession. Anybody that is practicing that profession that has not gone through the formal education and is not licensed is a quack. And the licensing gives you authority and power because you are in the profession that is protected. So, and we have in Nigeria the Medical Rehabilitation Therapists Board of Nigeria. That is the regulating body that accredits what we do as well as license us. And I believe also they are part of the system that accredits institutions. So it is important. So when we finish your degree, please go for your licensing. It gives you a lot of honor and respect. Do not listen to what anybody says, and guess what? It sets you apart from the quacks. It will set you apart from the quacks. Yeah, so it's important. So, what are some of the prospects of studying occupational therapy? As an occupational therapist, there are different areas where we can practice. We can practice in the clinical setting, in the hospital, in clinics, in rehabilitation centers. We can practice in acute care, we can practice in intensive care units, we can practice in acute intensive care units, we can practice in neonatal intensive care units, we can practice in those areas. We can also practice in community hospitals, we can practice in community hospitals. We can practice in private clinic, we can work in those areas, we can work in rehabilitation centers where we have all other professionals that are under the medical rehabilitation, i.e. the physiotherapists, the speech therapists, the occupational therapists, and some other ones that maybe we do not have currently in Nigeria, which I will mention, but I will mention the ones we have in Nigeria. So we can practice in those areas as occupational therapists and make changes in a positive way into the lives of patients. And guess what? Occupational therapy, it is not just about craft. It is not just about, because I have heard some stories that when some of
Recording in progress.
Can I continue now? Okay, thank you. So these are other examples of photos of where occupational therapists practice in centers and also in the community. Yeah. So one of the things that we do also, or we get involved in as occupational therapists, is policy and advocacy. Just like I said, that occupational therapy is relatively new in Nigeria, so we will and we should continue to advocate for our profession with the government and non-governmental organizations to see the importance of what occupational therapies do to individuals, the community, and the society at large, especially in the healthcare system and in the delivery of a holistic healthcare service to indigents and the people in the society at large. And also in public sectors, that is involved in health, in the public health initiatives to contribute to the development of the community.
Recording in progress.
Can you still hear me? Thank you. So please let me know if you cannot hear me. Thank you. So specialization in occupational therapy, areas where OT specializes in or where OT can work. We can work in pediatrics, like I said, and we assist and help children with developmental delay, disability, to attain their appropriate milestone, because sometimes when these kids have this developmental delay, they may be behind their peers. So, and the areas we look at are the fine and gross motor skills, we look at the social skills, we look at sensory aspects of the individuals. These are just few areas that we look at, and we help them to attain those things, as well as to be able to function in school, as well as in their occupational role. And so when we treat children in this category, part of the treatment method and mode we use is play first, because their occupational role is play. So we use play, we use play. So part of what we do also has to do with play therapy for babies and children. And we also work with the people, we work with adults, we work in the hospital,
evaluation, and treatment planning for patients having physical, neurological, and medical conditions. As an occupational therapist, Mr. Ododele helps in needs assessment and fabrication. He also has special interest in architectural evaluation of residential and public buildings for functional accessibility and career modifications. His company, Viking Rehabilitation Center, helps clinic and academic institutions with the fabrication, procurement, and supply of rehabilitation equipment. Certifications. Mr. Ododele holds professional certifications in various fields of occupational therapy, which include occupational therapy intervention in neonatal ICU, occupational therapy in mental health recovery, and so on. As a researcher, he has co-authored 2 peer-reviewed papers in reputable journals. Awards and honors. Mr. Ododele was the best graduating clinical student in Federal School of Occupational Therapy, Oshodi, Lagos State. He was also the best occupational therapy clinical student in the Department of Medical Rehabilitation, and also the best graduating occupational therapy student in the Department of Medical Rehabilitation in Obafemi Awolowo University. Leisure and social activity. Mr. Ododele is an active member of the Royal Elite International Club in Okini, Osogbo, Osun State, Nigeria. A club dedicated to alleviating poverty in rural areas of Osun State. Mr. Ododele is also the founder of the Ododele Rural Development Scheme, a notable platform that has provided quality health care services to over 600 women and children in Osun State since inception in 2021. Mr. Ododele is a devout Catholic and is married to Elizabeth Uzoma Ododele, and the marriage is blessed with 2 children. Ladies and gentlemen, join me as I welcome Mr. Ododele.
Good morning. The Vice Chancellor will be represented by the Dean of Medical Rehabilitation Faculty, the Medical Rehabilitation Faculty Dean himself, Professor A.T. Olumide, the librarian present, sir, my Oga, a very good Oga, Dr. O.A. Olawi, we call him English because he speaks very good English when we were in school. He is my teacher, and I think you'll be proud to see me here today. Beautiful students of occupational therapy, ladies and gentlemen present here today, good morning once again. My name is, like you have been told, Ogundele Victor Oluwadamilare Fernandez. I'm very proud of that last one because I'm a Catholic. Alright, this morning I will be discussing with us occupational therapy for all, exploring education, prospects, and roles in multidisciplinary healthcare system in Nigeria. The outline we'll be working with this morning is the introduction to occupational therapy as a course of study, training and certification in Nigeria, prospects of studying occupational therapy in Nigeria, potential for research and development, role in multidisciplinary team healthcare system in Nigeria, impact on community health, challenges and future directions, and the concluding aspect of it. Before I continue, I learned some of the students are in 200 level, some of the students are in 100 level, and I know that in this age and time, curiosity takes the better part of us. So when you are in an institution studying a course, you probably would have dabbled online, read some material, because I don't expect you to go into core of what occupational therapy is, but I'm sure I saw a video from this school of some of the students that have gone a little bit into what occupational therapy is. So I don't know what time I'm given. If I'm permitted to, I'd like to hear from at least 2 of occupational therapy students. But first, if you are an occupational therapy student in this building, can you please stand up? You know you are an occupational therapy student. Please stand up. Wow. Now look at yourselves and give a round of applause to yourselves. This time you want to use to answer your own question. It's not part of my 30 minutes. So, 2, just 2. Okay, the lady in front and the lady at the back.
From what?
Your name is?
I'm Widow Christian.
Okay.
From what I've learned so far, occupational therapy is a client-centered health profession concerned with promoting health and well-being through occupation. And occupation to a layman is not able to learn anything, but to an occupational therapist is what you do from sunrise to sunset, from when you wake up in the morning till you go back to bed. Thank you very much.
Thank you. Please clap for her. She has done very well.
My name is Sharon Gabar. From what I understand about occupational therapy, to me it is a very mankind-helping centered course. In as much as it helps people with every challenge of life, be it cognitive, physical, to be able to incorporate back into society and be able to do things no matter how big or how small they are, just to help them be independent and live their lives better. That's what I understand.
Thank you very much. Okay, so now, like you said, occupational therapy is a client-centered profession promoting independence in daily activities for individuals facing physical, mental, or social challenges. Textbook definition. This is my own definition. Occupational therapy is a healthcare profession that helps individuals carry out their day-to-day activities. Now, individuals, healthy, unhealthy, alike, individuals, everybody carry out their day-to-day activity despite their current state of health. Despite their occupational therapy doesn't aim at getting you alleviated. It is not just about getting you out of the illness. It is about while you are in the illness, you are a human being and you should still fulfill purpose as a human being. Now, the concluding part of that definition is despite their disability or inability, using purposeful and meaningful activities. I woke up this morning and I was prepared to come here. I've always put on my shoes myself, but the difference with putting on my shoe this morning is it is a step in the many procedures that will bring me here this morning to speak at this seminar so that we can celebrate World Occupational Therapy Day in UNIMED Ondo. The bigger picture, celebrating UNIMED Ondo. The smaller picture, me on my hotel bed this morning, trying to put on my shoes. Tomorrow morning, me putting on my shoes, the purpose is for me to be able to probably go to the embassy and apply for attend a visa interview because I've been called by WHO to speak at one of their conferences in probably Berlin on something representing the country in occupational therapy. That's the purpose, the bigger picture. So now, occupational therapy zooms in and out. We zoom in to the microcosm, the things you do on a day-to-day, the things you do minute to minute, and then we zoom out and see how well these things become an integral part of a bigger picture that impacts you, impacts your family, impacts your society at large. That's my definition of occupational therapy. Now, the purpose and goals of occupational therapy is to maximize functional independence, improve quality of life for individuals across all ages. An infant has quality of life. An elderly person aged 98 has quality of life. The job, the purpose, and the goal of occupational therapy is to make sure you enjoy life at any age you are and any stage that you are. Now, the scope of occupational therapy spans multiple areas such as pediatric care, mental health, physical rehabilitation, and geriatric support. Pediatric is children, mental health, individuals living with one mental disorder or another, physical rehabilitation, adults and children suffering from physically debilitating conditions, and geriatric support, the elderly people. All of this will be elaborated upon as we go on. Now, occupational therapy as a course of study in Nigeria. Currently in Nigeria, occupational therapy is studied either as a diploma program or as a degree program at various institutions. The institutions offering OT include 3 diploma schools in Nigeria: the Federal School of Occupational Therapy, Yaba, Lagos. UPTH also has a diploma school, and UPTH also has a diploma school for training occupational therapy diploma holders. Ondo University, the first institution in Nigeria to start training degree holders in occupational therapy in Nigeria. And then, of course, very own, your beautiful Citadel of Learning, University of Medical Science, Ondo, where we are celebrating today. Entry requirements for studying occupational therapy: SSC, UTME, and institutional specific requirements. Like University of Medical Science, Ondo can say if you have UTME score and you have an SSC score, we're still going to conduct our own entrance exam. Some universities don't. Some universities do. Some universities just submit your screening. Basically, regular entry requirements for healthcare profession in Nigeria. Now, the course curriculum, it's a 5-year program in Nigeria. The first 2 years, you take foundational courses, anatomy, physiology, psychology, and introduction to rehabilitation. You would often wonder why someone said occupational therapy is just to, when I was in 300 level in OA, somebody, a professor, said occupational therapy, we go there now, we sit there, it's just to cook soup, they do, and to make soup, and do all of that. And then as a student, you're coming in, and the professor has said that, and then you ask yourself, why are they making me study anatomy, physiology, psychology, and introduction to rehabilitation? First thing is, the soup aspect that professor saw is 1 out of 1 million modalities that we use in occupational therapy. Now that soup, let's analyze it. You want to teach a patient how to make a soup. A patient that has contracture in the elbow, how to make a soup. Now the pot of soup is here, and your patient needs to stir the soup. If you don't understand the basics of anatomy, your patient is going to throw away that soup, and then you will not only have a patient with contracture at the end of that session, you will have a patient with burns, and then you're going to be liable because you know that contracture has limited that patient because of your knowledge of anatomy. And then instead of forcing the patient to gracefully stretch an arm that is contracted, you invent something that makes it easier for that patient to go closer to the box and stare in that direction, and gradually that contracture begins to loosen up because there is continuous use of that joint. There goes your knowledge of anatomy. That's why you need it. Physiology, you need to understand the basics of how the human body works, functions. Psychology, you're going to be dealing with patients, people that are living with one mental incapacitation or the other. If you don't understand how the human mind works, you're going to be at a big loss by the time you start practicing. Now, introduction to rehabilitation takes you through the process of the history of rehabilitation, how it started in the world, then they narrow down to how it started in Nigeria, and they narrow down to occupational therapy, how occupational therapy started, post-World War, post-this, post-that. The essence of all of that is to get you to know and to love what you have come to study. Rehabilitation centers and community clinics to develop hands-on, because 90% out of the time occupational therapy is a hands-on, face-to-face kind of practice. Professional training and certification. The governing body for occupational therapy in Nigeria is Medical Rehabilitation Therapists Board of Nigeria, licenses and regulates occupational therapy practitioner and the occupational therapy practice itself. Currently now, the MRTBN is in the process of creating a genuine, generally acceptable scope of practice for all rehabilitation professionals. So it's one of the key things that they do. Now, the Occupational Therapy Association of Nigeria at the time is one of the bodies that oversees what occupational therapists do in Nigeria. Now, what do they do? They provide advocacy, training workshops, and updates in occupational therapy, like organizing a CPD, continuous professional development, where you'll be certified in so many techniques that might be brought on board. The continuous professional development, like the case study that the annual training by MRTB on recent OT advances using assistive technology in stroke rehabilitation. A friend of mine traveled out of the country recently and he was sharing his experience
experience, the first days he spent in a European country, he said he was staring out of his window and then he saw a man, a wheelchair-bound man, wheel his chair, wheel himself to his car. And then he was like, where's the person that will carry this man and all of that? And then the man got into his vehicle, pressed something beside the wheelchair, the thing depressed, and then seated into his car, and then pressed the button, and a robotic arm came out from the back seat, folded the wheelchair, and packed it into the car. And then I asked him, I said, when will Nigeria get there? So these advances, getting the knowledge, because we are in Nigeria now, the government is not making provision for that kind of equipment, does not mean we should not know how to teach a patient its proper use. So now, this CPD now, this example of CPD now, MRTD will now organize it and say, come on, we have learned that in Europe there are advances in the use of assistive technology for helping stroke patients. Come and learn. You graduated quite alright, but you still need that. That's one of the case studies of the CPD that we do as professionals. Now, maybe you didn't, but I suddenly asked myself, when I finish now, what will I do? Where will they employ me? See, occupational therapy, they speaking all this English now. Where will I go? I asked myself, and I'm not sure, but I think many of you should have asked yourself too. Now, this is your response. This is the prospect of studying occupational therapy in Nigeria. Look at the heading. In Nigeria. So I did not say they've done to bring UK standard for us. Now there's no. Prospect of studying occupational therapy in Nigeria. Now, there is growing demand. There is a rising need for occupational therapy services due to increased awareness and healthcare demand. 2 years ago, this kind of awareness did not happen in Unimed. Last year it happened. I was here, the people were not as many as this. This year it has increased awareness. People are getting more knowledge, more insight into what occupational therapy is. The more insight people get, the more the need to employ you to do a certain thing that is occupational related gets. Now the career opportunity you have. You can be employed in hospitals, rehabilitation centers, schools, NGOs, and community settings as what? In a hospital environment, you can be employed as an occupational therapist to see to all kinds of patients, all, including patients that have malaria. I'm serious, including patients that have malaria. You see, some parts of the world, when you come into the hospital, they don't see you as someone that has come with a fracture. They see you as an individual that something has happened to. So they don't just take care of your fracture and send you home. They take care of your fracture. They take care of what the fracture has affected in your life. There's something we call the Kawa River model in occupational therapy. It still sees the human life as a story. The human life is a story. You all know the story. Nollywood film now. Somebody has money, then the father dies, and the children now suffer lack of money, and then somebody that their father has helped now come from abroad and takes them abroad, and they all live happily ever after. That's exactly what occupational therapy is. The illness is the death that happened to the father. And now the children, which is your body, the body of the affected individual, now suffer lack of funds and they cannot go to good schools, and then they have a tendency to become touched. The same way the body has a tendency to be incapacitated for life. Now, the rich uncle that the father has helped before is the occupational therapy intervention that is coming to put a happy ending to the crooked story of an human life that has been made crooked by diseases and disability. So, your work in the hospital setting is to assess, evaluate an individual and identifies the areas of functions of that individual that has been affected by the illness. There is a simple way that we do that as occupational therapists. We call something activities of daily living, ADL. It's divided into two, BADL and IADL. The BADL consists of the activities you do: grooming, toileting, bathing, dressing, which includes brushing your hair and doing all of those things. Now, IADL is a lot advanced than that. It's mobility within the home, mobility within the environment, mobility within the community, care of others, care of pets, and all of those. So we pick out the one that is most appropriate at that time. Now, while you are on this hospital bed, which of the functioning aspects of your life, of the individual's life, has been affected? Now, let me use a typical example. And a patient was brought into the emergency unit of the hospital. This person has suffered a stroke, and he has been seen by the medical staff. He has been resuscitated, is now stable. And then he asked himself, what will OT do? This is what occupational therapy will do. There are phases of stroke recovery. When that person doesn't see an OT on time, it becomes a problem at the later phase when OT is involved. That you say you start to give intervention and there is no result. So this is what you do at that initial phase. You go to the hospital where the man is with what we call a finger spreader and positioning equipment. You go there and then you put it on the affected arm, so that when that person is coming out of the first phase of recovery and is going into the phase where there is going to be spasticity and all of that, the arm is not caught in a bad position. Without that, there is no medication for that. There is no injection for that. The only thing you can do to make sure that when this man is about to start outpatient recovery process, his arm has not gone into contracture, is for you to intervene as early as when the man was admitted. With what? Using a finger spreader and a hand positioning equipment. I wanted to bring one along, but I couldn't get my hands on it. Now, that's one out of many conditions that we have in the hospital setting. Rehabilitation centers, your job has already been cut out for you. In a rehab setting, your part is to work together with other rehab professionals. Collegiality in a multidisciplinary team to make sure that you maximize the function of that patient. In schools, now you ask, in a school again, what will occupational therapy do? Me, I was privileged to work with so many individuals across the country in developing what we call an individualized educational plan. Occupational therapists are the core administrators and executioners of an IEP. What is an IEP? An IEP is what will make an individual with a particular disability or incapacitation attend a mainstream school, but with a different curriculum. That's why you see they say Down syndrome, an individual living with Down syndrome in the US graduated in university. It is not because that child can solve calculus like you can. It is because that child benefited from what we call an IEP, educational plan that was tailored specifically to the abilities of that child. If a normal functioning child can count 1 to 100, the IEP goal for that child would just be, given the tenets of this child and the IQ of this child, once this child can comfortably identify number 1, promoting from number 1 to number 2. It's as simple as that. Then he gets to have a certificate, and he gets to be a education. For children that don't have access to playgrounds and all of that, we restructure the school in such a way that it gives accessibility to people of all ages and conditions. Now, in entrepreneurial prospects, now you don't want to work for somebody, you want to be on your own. There's prospects for you to opportunities in private practice. I own a private practice in Osun State, in Osogbo, and I can tell you we are doing very well. Then you can also go into equipment fabrication and consultancy. There is hardly no equipment that I cannot design. None. There is hardly no equipment that the Yoruba has made that I cannot redesign using local materials. I'll give you an example. I shared the story with Dr. Laje, I think some months ago. I was handling a man that needed to be transferred out of bed, and he has very small children. And the toll of moving him out of bed was moving to tell the caregivers and everything. So we needed a hoist. We went online and we checked the price of the hoist, and then we were looking in the millions. This man cannot afford hundreds of thousands, not less of millions. So I told the children, get me a welder that can think and can work according to specifications. And we designed the hoist, and the welder fabricated it, and we put in a rotor and a motor, and it works fine, just like that one that we import from abroad, perfectly well. It is in my facility in Osogbo, but because of potency and all of these things, you won't see pictures on the slide, because I intend to patent most of these things. Now, if you are the type that loves to bring out new ideas and everything, you can go into research. You go into areas that have not been touched. Now, luckily for you, all the areas in occupational therapy are under research. So you will research. Like this new show that I said, you go explain, tire. So you go research, tire. It's an ocean bed of opportunities for you. Now, there's this new thing that is going on. The tech brothers and sisters. I have to have tech brothers and sisters here. Okay. When I was doing my internship in the Federal Medical Center Abeokuta in 2019-2020, a friend of mine created a website. The sole function of that website is to marry patients to practitioners in physiotherapy. A website that you can log into, maybe website live. I know about it because I'm one of the test subjects of the website. You go online and then you can book a physiotherapist for yourself. Now something like that can be done in occupational therapy too. Now there are devices, medical devices that listen to and record heart sounds without you having to put stethoscopes in your ear. If the medical practice that has been in Nigeria for over 100 years is still having innovations, how much more occupational therapy that is not even up to 50 years in Nigeria? So you can invent things, you can make equipment, you can bring up new practices, you can carve a niche for yourself. Role of occupational therapy in the multidisciplinary healthcare system in Nigeria. Before we go into this, let me quickly give specific occupational therapy intervention with some dosages for some common conditions. Then we now start going into how you can relate that to working with doctors, nurses, social workers, and speech therapists, and all of that. Because I believe if you know what your job description is, blending in line with any other professional is not going to be a problem. Now, in stroke rehabilitation, your intervention is task-oriented training. Sometimes you can do constructive-induced movement therapy and cognitive perceptual retraining. Now, like every other treatment intervention, occupational therapy treatment too have dosages. So when you make it scientific, it becomes less of a mystery. You carry a profession and then you don't let people know what you are capable of doing. The science behind the practice of occupational therapy is much more than what some people have made public. So now we are throwing it outside so that everybody knows that occupational therapy is not just a program where you come and learn how to use toys and play with kids and then how to teach somebody how to. No, it is so much more than that. Although those aspects are the modalities that we use to achieve the aim of the treatment. So now, when you say task-oriented training in stroke, what do you mean? This person used to be a lecturer. Now he has had a stroke. He needs to go back to being a lecturer despite the stroke. First question you ask yourself is, the way I am looking at this person, is the goal feasible? Now, if you can answer that question as a therapist, if not, then you relate with other healthcare professionals and say, there is nothing like discarding a client's goal. You don't discard a client's goal. The patient comes to you and say, I want to go back to lecturing. You don't say, the lecture, no, possible. You don't do that. If you cannot do it on your own, then you take it to FPT and say, Dr. Ademi, this is my patient. Each time he tries to use his hand, there's this tremor that keeps happening regardless of any kind of rehabilitative procedure I do. So then you go and the neurologist gives you recommendations for medications to that patient or not to you, to the patient. Your patient takes the medication, the tremor stops, and then your training can start. Collaborative effort, togetherness, working together. Yeah, this patient is in acute care on the bed, but because you don't want to work together with the nurses now, your salary structure is more than their own. You are doing like this, and then the patient is going to suffer. You go there, you document. Turn this patient every 2 hours, so that this patient can receive sensory information from all angles. Maneuver this patient away from back posture to side posture. Change this patient's posture, not because of bed sore, but because the patient needs to receive sensory information, audio information, visual information from all angles, so that this patient can recuperate faster. There are some patients, when they have stroke, they have hemi neglect. They don't even know that one side of their body exists anymore. Those kind of patients, you need the nurses on the ward. Collaborative effort. How do you work with speech therapist? Your patient has aphasia. You work together with speech therapy to resolve the aphasia. There are parts of the occupational therapy program that can help a patient with aphasia, but you need a speech therapist to help you overcome that hurdle. Otherwise, you will be stuck, and then you will be a bad therapist. Collaborative effort, working together. Now, the dosage for your treatment plan in stroke is 3 to 5 times per week. For 60-minute session, your patient can endure that much. 8 to 12 weeks, depending on the severity. That's dosage. If you are going to write a prescription for someone, you can write that in your prescription. It's acceptable. Many professionals, practitioners in the hospital, they don't know what to do. They want to know what to do. But it's in a different way to talk to you and say, anytime you can say, anytime you can it's take it with joy and then teach them what you do. The focus on stroke rehabilitation is on upper limb function, balance, ADL, and cognitive skills. For traumatic brain injury, your intervention is sensory integration, cognitive behavioral training, and visual motor integration. Your focus is restoring cognitive and motor skills and promoting independence in ADL. For cerebral palsy, your treatment is neurodevelopmental treatment, muscle strengthening, and adaptive device training. Dosage 3 times per week, 30 to 45 minutes. Ongoing. You see the dosage for 8 to 12 weeks. They said it is ongoing because cerebral palsy is a permanent thing. It's not something that resolves. So therefore, your therapy too is ongoing. It changes. The focus of the treatment changes with the life of the patient. Now, this patient is no longer in preschool age. This now patient is that age. You go on and on and on. Like that. For autism, there is intervention, there is focus. For ADHD, there is intervention and focus. For Parkinson's, there is intervention and like that. So now, collaborative care, OT work with physiotherapists, doctors, nurses, social workers, and speech therapists per the need of your patient. Specific contributions of occupational therapy in all areas includes functional assessment and intervention, patient-centered rehabilitation plans, then the case examples, stroke rehabilitation, pediatric care. Now, when I said OT treats malaria, many of you were laughing. This is OT's guide to malaria treatment. It is not exactly our department, but this is what we do. When somebody has malaria and he needs OT, activity modification. My Dr. Laje came in with malaria yesterday, so he is weak. Instead of sitting upright, look at him. He has modified his sitting activity. He is slouching in his chair because it gives him more support. Energy conservation. He usually laughs more than this, but he's conserving his energy, he's laughing less. Environmental adaptation. He is sitting closer to where a fan is so that his sweating will not be obvious. Mindfulness practice. Instead of him to be in distress and you know he's in distress, he's been observing what we call breathing technique since. I said observing, he's been doing it on and off to make himself calm. The medications will work, yes, we know. But he has to be here too, yes, we know. So these two situations need to go together. So that is a living and working occupational therapist that has planned OT intervention despite the medication he's taking for himself. Now, aftercare activity. The aftercare activity is to make sure that it doesn't happen to you again. So what do? You get rid of the mosquitoes in your home, and then you make sure that they don't bite you again, so that you don't fall victim anymore. Now, there's a disclaimer there. OT treats people, not malaria. But isn't the goal about keeping you healthy? Yes, the goal is about keeping you healthy. And occupational therapy does just that. Now, this is a prescription for occupational therapy malaria treatment. The name of the patient is Anopheles Chukwueze. He's 24 years old, and the diagnosis is malaria. The goal is to restore energy and maximize comfort. You see how it is going. Do you see? Now, the treatment is TAB, mandatory couch rest. Move from bed to couch, couch to bed. Make sure you rest. PRN means pro-renata whenever necessary. TAB, anti-itch maneuvers. There are techniques you do to make sure you don't itch when you are on some medications or malaria itself can present with itching sometimes. So anti-itch maneuvers whenever necessary. TAB, functional malaria defense system, 1000 mg, 6 hourly, 5 days. What that means is that while you are having that malaria, you functionally defend yourself from those things those nasty little bugs. IV hydration, 500 ml, 6 hourly. You drink plenty water. back, or when you eat snacks, you eat so that your energy will be back. Signed, Dr. Obere. Good. Now, the impact of occupational therapy on community health in rural and underserved areas is to enhance access to rehabilitation service, to create vocational rehabilitation opportunities and training, maternal and child health support, empowering local health workers in basic practices of occupational therapy like transferring a patient, teaching them the proper technique to transfer a patient and all of that. Then the public health initiatives are OT in mental health, to carry out these activities, awareness and stigma reduction for mental health individuals with mental health, elderly care, prevention of fall and mobility training for the elderly in rural areas, then preventive health programs, education on ergonomics and work safety. Ergonomics is fitting an individual to a particular job. It's not the job. It's not the person that should fit to the job. It's the job that should be fitted to the person. The fact that I am wheelchair bound doesn't mean I can't walk anywhere. There are so many wheelchair bound people that are going under economics training, and the job has been tailored to their current condition. It is called OT practice. Now, examples of OT in community health is the one that usually happens in the year by every December, when we take patients living with mental health, take them to the beach, and we have one nice day with them at the beach. I don't know if they still do it now, but they did it then when I was a student in Federal School of Occupational Therapy in Shoji. Now, challenges and future directions in Nigeria. The current challenges we have is limited awareness. Many communities lack understanding of occupational therapy's benefits, which limits service utilization. If you don't know what I do, you can't use me. It's a big problem we need to solve in the healthcare sector. Hence, the use of the multidisciplinary approach. If you recruit one person from all the disciplines in the hospital to attack a particular illness, then they all get to know what they get to do for that patient. And then from there, each patient's testimony leads to much more awareness and utilization. Resource constraints. There is insufficient funding for occupational therapy facilities and limited access to adaptive devices. Now, the future goals and advocacy is to expand occupational therapy programs in more Nigerian universities, public awareness campaigns to educate communities on OT's role in improving quality of life, partnership with tech innovators to develop affordable rehab devices and applications. Occupational therapy is a profession in Nigeria. As a profession in Nigeria, plays a critical role in advancing patient-centered healthcare through education, functional rehabilitation, and community integration. Call to action is for all of us, professionals and professionals to support OT's development in Nigeria, to build a more inclusive healthcare system, and to encourage students and professionals to pursue OT as a rewarding career that makes a lasting impact on the society. Thank you very much.
A round of applause for Mr. Ondo. Thank you very much, sir, for that wonderful lecture. Without wasting much of our time, while the lecture was going on, we have the presence of the Chief Medical Director of Unimed CH, in person of Dr. Michael Bala. You're welcome, sir. In a bit, we are going to see a video, goodwill messages from professionals across the globe. Stay tuned, let's listen to it.
Hi there.
in your hand today. I am a registered occupational therapist in Manitoba province of Canada. In recent years, I have practiced in mental health rehabilitation and acquired many degree programs for youth and young adults. Now, I provide occupational therapy services for older adults from 60 years of age. Working with older adults is rather fulfilling for me because it's this expression to my advanced study in hygiene and health. So, what is occupational therapy? According to the World Federation of Occupational Therapists, occupational therapy is a client-centered health profession concerned with promoting health and well-being through occupation, with the primary goal of enabling people to participate in activities they want, need, or have to do in everyday living. Client-centeredness is ensured through collaboration both in an interprofessional and intraprofessional environment by using and promoting shared decision-making approaches. The theme of World Occupational Therapy in 2024 is Occupational Therapy for All, reflecting the important role of the profession. Because occupational therapists provide services to a large clientele, the profession hopes for sustainable prospects in terms of job availability in both private and public sectors. Globally, occupational therapists are also thriving as self-employed and employers of labor with titles like entrepreneurs, private practitioners, consultants, and managers. In recent years, we see occupational therapists taking up non-traditional roles in novel settings such as primary care, non-COVID patient care, and working with refugees and asylum seekers. If you are an occupational therapist student today, I want to encourage you to think outside the box. You are in a unique profession that will mold your perception positively. When you see through your occupational therapy lenses, I can assure you that the room for growth is limitless, and you can never miss putting smiles on someone's face every day. I want to congratulate the faculty of the Department of Occupational Therapy and the entire community of the University of Medical Sciences, Ondo City, Ondo State, Nigeria, on the gallant condecoration of the World Occupational Therapy in 2024. Long live occupational therapy.
of the country you're working in, in terms of the healthcare setting you're working in. Previously, I used to work in UTA, and I think that how do I say it's different. It's practiced in North America, in England, in Nigeria, etc. So it's very different working. So I look forward to you joining me as an occupational therapist and my colleague sometime in the near future. And I look forward to hearing that you're people advancing more from here than I am. Nigeria is a beautiful place to do as an occupational therapist. We share a lot of creativity. Nigeria offers you. It's beautiful. I wish you all the very best. And I wish the university when I collaborate with you best, or maybe a word of occupational therapy. I collaborate with HOD, Mr. Ayelis, this is as well as I collaborate with the entire university community on this beautiful. Thank you for the occupational therapy. Thank you for remaining the voice to bring down the rest of our profession. Thank you very much.
Hi, my name is Laje. I presently work in Manitoba, Canada. I am a community-based occupational therapist as well as a PhD candidate at the University of Manitoba. You must have known or heard different definitions of occupational therapy, different definitions of OT. But in layman's terms, I'm going to define OT as a medical rehabilitation profession that help individuals of all ages to do their day-to-day tasks that are necessary and meaningful to them to improve their health, well-being, and quality of life. OT work with patients experiencing physical, mental, or developmental challenges that interfere with their ability to do their activities. What I mean by activities are general day-to-day activities like dressing, like making meal for yourself, like going to the toilet, like going to work, like going to study, or engaging in play, or hobby or leisure, enjoying leisure. The prospect of OT cannot be underemphasized, but I'm going to say this, that OT are needed everywhere, because you can go into your private practice, you can join different sectors of occupational therapy. You must have heard that the phrase holistic view in OT. But this to the student, I must say that OT must personally influence you before you can influence anybody as a career. Before you can take it as a profession, you must be impacted by that profession as a core. OT, we talk about work-life balance, all those things must be reflected in who you are in your being before you can help a client. Areas of specialization in OT include pediatrics, geriatrics, mental health, forensic, physical rehabilitation and disability, hand therapy, sensory integration therapy, school-based therapy, community-based therapy like I'm doing, driving rehabilitation, assistive technology, and even palliative care. And there are other areas of specialization still coming up that we will see, because OT is fast evolving. I'm going to use this moment to celebrate with the faculty and members of the Department of Occupational Therapy, University of Medical Sciences, Ondo City, Ondo State. I also commemorate with our leaders, our mentors, our teachers, our doctors, and World Federation of Occupational Therapy. Long live occupational therapy, long live World Federation of Occupational Therapists. Adios, we'll see you good life. God bless you all. Bye.
Hello, I am Toby Okunle. I am an occupational therapist currently practicing at the Federal Hospital Yaba, where I work with other healthcare professionals to provide rehabilitation for individuals who are living with mental illness and drug addiction. It's my role as an OT to assess and provide intervention for the individuals who have difficulty performing their daily occupation as a result of this mental illness. Now, the term occupation, as opposed to generalized definition of it being the work a person or the job a person does to earn an income, to me as an occupational therapist, it simply means the daily activities the person engaged in that they find fulfilling, the things that they need to do, the things they want to do, and the things that are expected of them to do in their daily life. So it's my job as an occupational therapist to provide a client-centered service to ensure that these individuals are able to perform this occupation, are able to perform their self-care, are able to perform their leisure, are able to perform their work roles as independently as possible, regardless of the mental illness that they are living with. I currently work in a mental health setting. However, this is one of the numerous aspects of practice for an occupational therapist. The theme of this year's World Occupational Therapy Day is Occupational Therapy for All. I believe this captures this gives light to the relevance of the OT profession. This gives light to the relevance of OT in rehabilitating individuals, regardless of their age, regardless of the condition they're living with, regardless of the illness that they have. It gives light to the role of an occupational therapist in rehabilitating these individuals to be able to perform their daily operations, to be able to perform the activities they need to do, the activities they want to do, and the activities that are expected of them to do. So if you're students that you're aspiring to study this profession or you're already studying it, my advice to you would be to be fascinated with this, profession. Let your fascination drive you to know more, let it drive you to gain a knowledge about this profession. This will aid you in your practice. So shout out to the Ringmed community, shout out to the Faculty of Medical Rehabilitation, shout out to the Department of Occupational Therapy. Shout out to you, kudos to you, continue the good.
Also, in terms of
you would see the outcomes in that sense. One of the things that I've embraced within my as a person who has worked in the UK for a while is to always ensure that whatever I do, the presence or the impact of whatever I'm doing is quite felt among my colleagues, among people in the wider multidisciplinarity in that sense. One of the things I tend to do quite well is to publish my work quite regularly in that sense, to show the impact of what I do in that sense. So what I would say is that have a personal responsibility to be the best at what you do in that sense. Wherever you are, be the best. That involves you training, you apply whatever you learned into practice, to be the best in the situations you work with in that sense. Sooner or later, people will recognize that, and that can lead to more progression and more rewards in that sense. Yes, and I wish all of you the best in terms of your studies. I wish you that you succeed quite excellently. And also, always remember, I'm there for you. You can always reach out to me. Once again, happy for Occupational Therapy.
A round of applause for all professionals across the globe. Let's clap. Thank you. So we'll be having goodwill messages from the students as well. It's a video, so let's listen. Thank you.
Now, occupational therapist in my very minimal experience, even a whole lot of research, has proven me to be a very mankind health-centered course. However, occupational therapy is a course that incorporates everybody into the spectrum, meaning individual, physical, cognitive, or sensory problem can be incorporated back into society, and occupational therapy works to help them do this in a way that allows them to be.
Occupational therapy is highly centered profession for putting health. Before joining this program, I had limited knowledge about autism. However, through my study and theoretical experience, I have gained a lot about autism and the impact on people's life. Now I will say, through coursework and research, I have gained insight into both holistic approach, focusing on occupation and the need to promote health, well-being, and participation. Now I will say, OT is a good prime and very good course.
What do you think of occupational therapy is about empowering individuals to overcome challenges. As an aspiring occupational therapist, what do you think by design for
When I first started, my knowledge about occupational therapy was quite limited. I knew it was about helping people with their physical and cognitive challenges, but now I realize how holistic and vital OT is. Addressing not only the physical recovery of people, but also the mental, emotional, and social well-being.
Occupational therapy is a healthcare profession that focuses on helping individuals to develop, recover, and maintain skills for daily living. Before joining this program, I thought OT was just about helping people with disabilities. But now, I have gained a deeper understanding of the impact on our mental health, daily living, and overall well-being.
My experience so far as an occupational therapy is that occupational therapy has been in schools in Nigeria is actually based on mental, social, and social abilities.
And now,
empathy and patience, organizational skills, creative problem solving skills, and physical strength. Of course, you need physical strength. And I know there are a lot of people asking what's the difference between physiotherapy and occupational therapy. Physiotherapy is a kind of therapy that deals with the disability of people to move. Yeah, if someone can't move freely, such person should see a physiotherapist. And if a kid can't write well, maybe kids have bad handwriting, such a kid should see an occupational therapist.
World Occupational Therapy Day will be celebrated in the University of Maple Science Campus.
Coming up on October 31st, 2024,
Join us in promoting awareness and ready to celebrate the power of occupational therapy.
let's raise awareness about this empowering, impactful, and transformative power of medicine. Thank you, and see you all in our meeting.
A round of applause for our students. The next on the agenda here is votes of thanks. Vote of thanks, and that will be done by Mr. Ifeanyi. A round of applause for Mr. Ifeanyi.
Good afternoon, everyone. As we reach the close of our celebration today, it's my privilege as chairman of the planning committee to extend a heartfelt vote of thanks to everyone who made this event a success. My deepest gratitude goes to our distinguished guest lecturers who took the time to share their insight and expertise with us on the theme of this year, the World OTT celebration. Your contribution have added great value to our celebration, reminding us of the vital role of occupational therapy in transforming lives. Also to our able guests who took out time out of their busy schedules to make themselves available for the event. Thank you for honoring our invitation, and thank you also to all our participants who have joined us in this enthusiasm and support. Your presence and engagement have really made this event special, and I hope you leave with a renewed sense of the purpose and passion for our shared mission, which is creating awareness for occupational therapy. Finally, let us continue our journey with inspiration gained today as we work together to advance the field of occupational therapy. Once again, thank you all for making this celebration memorable.
Now we move to the presentation of award to our guest lecturer, Mr. Ondo Victor, and the presentation will be done by the former assistant librarian, Mr. Florisho. A round of applause.
Thank you very much. On behalf of the University of Medical Sciences, Faculty of Medical Education, the University of Medical Sciences, you are represented this.
We are going on. How was the lecture so far? In one word. Speak louder. Wonderful. In one word. Interesting. One other person. In one word. What do you say? So we are going on. Let us rise for the anthem.